Well, in this new age of technology, many more teenagers are having a tough time with mental health. The CDC estimates 42% of high schoolers report feeling sad or hopeless. Some say social media is a big contributor to those feelings, and to help us understand a little bit more about why, we're talking with Dr. Monica Fitzgerald today. Dr. Fitzgerald, a clinical psychologist and senior research associate at CU Boulder. Dr. Fitzgerald, thank you so much for joining us. Let's jump right in. In your opinion, why are we seeing a decline in teen mental health?
Well, I'll just say that we have seen mental health, some struggles with mental health, but these declines, I think that COVID and the pandemic was really tough. It was hard on youth and in their families and their kind of experiences. They were cut off from kind of access to friends and community and consistent rituals and routines and kind of safety nets and even sometimes meals, or they're being exposed to, even harm sometimes. So they weren't in the community spaces where they'd have more access to resources. But resources and these elements have always been important for youth. But I do think that the COVID pandemic really did bring this to the forefront and helping us understand it. But the research is still not clear. I don't think it's actually helpful to make it be catastrophic. We're still really learning about those impacts, and we do know a lot about protective factors as well and buffers. But I do think it's challenging. There were a lot of family changes, and there was a lot more insecurity and a lot more struggles with having this disruption in these normal everyday routines and connections to the community, education and resources and safety nets. And it takes a while to kind of recover from that.
Dr. Fitzgerald, obviously a lot factors into this. We know that social media can play a role in it. It's not all bad, though, and we do want to point that out as we've talked a lot about the connection between social media and mental health, especially for teens.
Yeah, I think that's a really important point that you make, that it's not all good and not all bad. And so there's a real need for young people to feel connected, to have affiliation with their peers, right, and with others, and sometimes for information. And so there's this kind of gift of being able to have access to information really quickly. It's instant, or being able to connect to a community, especially for those that maybe struggle with finding connection or around them, or when their identities, they don't have belonging in the spaces that they're in, or maybe even more rural settings. But also it varies by kids, also their social skills. But I think that need for affiliation and social media can really help them feel connected to something. I think that's a strength, but it also can, those spaces and communities can sometimes also not be so helpful. Sometimes there's a lot of misinformation or poor information out there. There can be some real confusion that comes up. There can also be really helpful aspects where I might be getting information that normalizes and destigmatizes how I feel or what my experience is. Other times, you might have more of a tendency with social media, as you're scrolling through this instant information, to let more labeling or trendy diagnoses, or this pressure to kind of fit into something, and it reinforces I'll be seen and heard if I'm maybe sharing information, and maybe too much information or about mental health challenges or symptoms. And sometimes folks have talked about how social media can reinforce kind of a sick role culture, because you can get, or subculture, you can get a lot more kind of attention, but you can also get really great support as well. And I think that's important to remember. You can have folks destigmatizing.
All about finding that right balance, especially on social media. Dr. Fitzgerald, we got to run. Thank you so much for your insight today.
Sure,
as always,
no problem.
You can find our interviews on cbscolorado.com. We'll be right back.